Hi, my name is Priya and I'm from Baby Chakra, and we're in conversation with Dr. Indu Khosla today. Dr. Indu is a pediatrician and a pediatric pulmonologist with close to 30 years of experience. So we're going to be discussing the 6th, 10th and 14th week vaccination milestones with Dr. Indu today.
6, 10 and 14 are the same set of vaccines given 3 times over. So we cover very important 8 diseases, which are, most of them are life-threatening diseases. So therefore you must protect your child by giving these vaccinations. So the three doses of like 6, 10 and 14 of polio are given. Then you have the diphtheria, pertussis and tetanus. You have hepatitis B. You have the HIV, which is the H influenza B vaccine. You have the pneumococcal vaccine, and we have the rotaviral vaccine for diarrhea. So if I were to elaborate on each of these diseases, we all know about polio. India is polio free for the last 5 years, and it has only been possible because of vaccination. So polio, we have to still continue giving polio because our neighbors still have polio and children should have proper immunity. The next vaccine that we give is it's a triple vaccine which is for diphtheria, pertussis and tetanus. Diphtheria is a kind of a respiratory illness which can cause mortality. Pertussis is commonly called as kali khasi or whooping cough. And tetanus, as you all know, which you very commonly know that you would take a shot of tetanus if you had an injury. Right? So the tetanus is for those purposes to prevent anaerobic infection with this bug called tetanus bug. So these are the 3 vaccines which are given as triple. You must have heard of the painless and the painful. The DPT, the P component can come in 2 varieties, the painful and the painless one. The hepatitis B is a kind of jaundice which is transmitted if the mother is positive for hepatitis B, and these children who acquire it from the mother can have severe liver disease, and they can in fact go into liver failure if not vaccinated against it, and therefore hepatitis B is another important vaccine which is given. The Hib and the pneumococcal vaccine are the commonest life-threatening infections that babies have below the age of 2 years. Both these bugs can cause pneumonias, meningitis, ear infections, bone infections. So these kind of severe infections, and therefore we protect the child against these important diseases. Lastly, we also give the rotaviral vaccine, which we know India is one of the leading countries with lot of diarrheal deaths in children, and almost a good 40 to 50% of diarrheas in children is viral in etiology, and that can be prevented by rotaviral. So these are the set of vaccines that we give at 6, 10 and 14.
So are all of these vaccines administered together at the same time?
Yeah, so again, parents are extremely apprehensive. They'll tell us, okay, you give us one later. But there are studies to show that if all the vaccines are given together, the immunity that the child gets is far superior versus if this vaccine were given at a gap, right? And we also quickly want the child to be vaccinated against all these diseases. So it is important that these vaccines are given together.
Doctor, could you please help us understand the painless and the other kind of vaccines?
Whether painless or painful, I think you must not worry about it, because both vaccines are equally good and equally effective. As I told you, it's the P component of the DPT which can give rise to pain and fever, and the pain and fever persists a little beyond the vaccination. Of course, when you prick the child is going to have mild pain, right? But sometimes when you use the whole cell vaccine, you will have little pain and fever which may continue for about 24 to 48 hours, which can be controlled with paracetamol. Okay, so parents who are very apprehensive can definitely take the painless vaccine, but both vaccines are equally good, and I would definitely leave you with a key message that please vaccinate your child.
Thank you very much for that, Doctor.
My pleasure. Absolutely.
I think Dr. Khosla leaves us with a very important message that you should not be missing your vaccination schedules. So make sure that you take your child for vaccination as per the schedule given to you by the doctor.